many adults who have been traumatized as children, who now have avoided treatment in the office to the detriment of their oral health and systemic health because they've had a traumatic experience. We don't want that for our children.
Dr. Johnson, tell us one more time in a concentrated form, what are the benefits to parents, to the child, very obviously the patient, who needs dentistry done to get an anesthesia? What are some of the reasons why a parent should consider and say, let's go to a dentist who performs, or 99% of the time, I guess, or 100% of the time, brings in an anesthetist in order to get the child into the dental chair? Tell us a little bit there when parents should consider that.
Parents should consider this, and it's normally done in consultation with their dentist. If the child is uncooperative in the office and they need dental work done, then you consider several strategies. Many of those are tried before they call in the anesthesiologist. So they may try nitrous oxide, for example, and they may try several other procedures to coax the child into having anesthesia done. But generally, those fail, and then they call us. So the benefit is to have a more comfortable, less traumatic experience for you or your child. There's no parent who wants to sit in the office and see their child screaming, getting dental work done if it can be avoided. So many times, us as the anesthesiologist provide that for the parent where the child can at one time have all their dental work done and safely, comfortably, and without any trauma. And that in itself is a tremendous benefit for parents and for the child, because think of it that there are many adults who have been traumatized as children, who now have avoided treatment in the office to the detriment of their oral health and systemic health because they've had a traumatic experience. We don't want that for our children. So what we're doing is making sure that we can take care of them as they're young. And then as they get older, you're not wanting to do this multiple times on a child either. I want to get that point across. While we are happy to make sure we give a child a comfortable, safe experience, we don't want to do it repeatedly, unless, of course, we're working with children who may have special needs that cannot be seen any other way. But we want the child to get comfortable with seeing the dentist and having work done awake in the future. But the benefits are huge to be able to have a child get all their work done at one time and it's over. No multiple visits to the office, no screaming kids the whole time, no kids afraid to go into the office every single time. We come in and we take care of that. And the parents can go home and rest assured their child is safe and all the work is done.
I get that. And that's wonderful. So basically, maybe disciplining the child instead of making the child brave and, face this and do this. And we all do this. And some say, hey, use a little force, whatever, I'm not saying slapping him around and boom, but instead of, making the child feel like there's something wrong with him, or the parents feeling there's something wrong with the child because he has some anxiety about this. Actually, it's not important. It wouldn't be mattering. There is an anxiety. You're not getting the child in it. Go and check with your dentist first about an anesthesia. Why? Because this friction could be leading for that child to become a man, a girl, a woman, run around with crooked teeth, run around with otherwise bad thing. And we know that bad oral health is having way more implication than most of us even realize, because we have infections in the mouth and or we don't look so good. It's the saying, we might not even realize it, how much this has to do. Not for nothing, $1 million smile somehow got the name. It's $1 million smile, the Julia Robertson smile, the Tom Cruise smile. It is worth some, period, end of discussion. Even if it's just for a banker job. So parents should check into it of like what can and should be done there. It isn't worth the drama, forcing the child into be a man. Just go in and get the dentistry done without any unpleasantness. Is that what you're saying?
That's what I'm saying. So I'm saying that I know there are parents who are maybe listening that are apprehensive to this, and I totally understand that. But these anesthetics are provided in the office several hundreds of times a day or every day of the week all across the country safely. And you want to make sure that your child is not traumatized by an experience that does not have to be that way if they can have sedation and anesthesia that will keep them comfortable, get all their work done at one time, and then you don't have to worry about that for a very long time after that, if at all. Sometimes I've been to offices where I am providing anesthesia in one operatory, and then next door the child is screaming because the parent refuses to consider anesthesia at all because they feel the child, number one, that the child can toughen through this whole procedure. I disagree, or because they are afraid of anesthesia in general, which I understand. And I'm here to help provide and explain how it's done, understand that it can be done very safely and that parents need not to be afraid of it, but give their child the best opportunity to have their work done in the least traumatic fashion possible.
It's not worth traumatizing the child.
Not at all.
I get it. Thank you very much, Dr.
You're
Johnson.
welcome.